हाँ हाँ,
चीज
अभी तो
करने
किसी
मेरे
और
को
ने ज्वाइन नहीं किया है, सबको ज्वाइन कर लेने दो।
हाँ हाँ, बस 2 मिनट, बिकॉज और तुम्हारी मीटिंग हो गई वहां पे?
हाँ हो गई अंजू, तुम लोगों ने वेबसाइट खोल के देखा या नहीं खोल के देखा अभी तक? खोल लेना किसी दिन।
जब जीएच, जब तुमने वो डाला था ना अपने ग्रुप में, दैट टाइम आई सॉ, हाँ उस समय देखा था, पर मुझे बहुत दिखा, समझ नहीं आई थी, फिर तुमने कुछ लिखा था, उसके बाद आई लॉस्ट द कॉन्टैक्ट।
हाँ हाँ, देख लेना।
श्योर।
हाँ, तुम्हारा पेन वेन ठीक है?
और 90% आराम है, एक बस वो अनकंफर्टेबल लगता है ना, कि बिकॉज इसको कुछ कर नहीं सकते एक्सेप्ट एक्सटेंशन एंड फ्लेक्शन, नो। So better not to use this mic. हरिबो, हाँ दे रहे हैं, हाँ हाँ श्योर श्योर श्योर, ठीक, थैंक यू।
सवार है। Anju, I want to test my audio. Can you hear me? This is Banani.
Banani, very well. I can hear you. Thank you so much for joining.
Okay.
Just
Sure.
2-3 minutes.
We can hear you very clearly, Banani. Hi.
Hi. Oh, there's some new laptop, so I'm just testing it. So you take a Zoom your own, or this is institute's connection?
Institute, telemedicine.
Okay.
We have requested to,
Good.
because of Corona, we were not meeting or doing any kind of academic work. So we just requested for once or twice.
No, this is a very good topic. This
And
is
this
really a
is
good topic.
important. So I just put it in almost whatever relevant group I felt.
Yeah. I'll mute myself now.
Okay. So Prerna,
Yes, Anju.
should we
You want to
start?
start now? अभी तो लोग बहुत कम हैं.
मेरे को
बाकी लोग कहाँ हैं?
डॉक्टर प्याली, दीपा जी और अजीत तो मेरे को दिख रहा था अभी.
अजीत तो दिखा था, फिर गायब हो गया. और 2 चेयरपर्सन थे, वो कहाँ गए?
हाँ भाई, मे भी बिजी होंगे शायद. कोई बात नहीं. डॉक्टर प्याली एंड दीपा जी भी कर देती हूँ मैं. जस्ट गिव 1 मिनट तो मैं ज्वाइन करो, वेट करें आपका। दीपा जी ज्वाइन करो, वहां पे जो भी उनको भी या तो बोल दो अपना इसमें खोल ले, या फिर वेट करते 2 मिनट वेट करें, 2 मिनट वेट कर लेते हैं। हाँ आप ज्वाइन करो फिर।
हाँ अंजू मैंने ज्वाइन कर लिया।
ओके, डॉक्टर दीपा इज ऑल्सो ज्वाइनिंग, देन विल स्टार्ट, जस्ट 1 मिनट वेट कर लेते हैं उनके लिए। Should we start, Dr. Piyali?
बिल्कुल बिल्कुल बिल्कुल।
People will join gradually, no issue. So, just once. Yes, cervical cancer awareness. Today is the topic of today's cervical cancer awareness, and this is very. This topic is very close to my heart. I chose this topic because January is the National Cervical Cancer Awareness Month. Am I audible to everyone?
हाँ जी सुनाइए।
So, just for those who are non-gynecologists, this green, especially the color of cervical cancer is teal green. So this green is teal green ribbon. We all, most of the places we used to depict cervical cancer with this kind of.
ठीक है ना? हाँ हाँ ओके, और क्लिंडा लिख देना।
Cervical cancer, this is the common lady, which is saying no to both breast cancer, which is #1 in the our country, and cervical cancer, which is #2 in our country. So this is the message.
2 मिनट बाहर बैठ जाइए।
Let's have the look on the burden of cervical cancer. Why we are so much worried? Cervical cancer is the second most common cancer among Indian women. As I just now told you all, globally, 1 woman dies of cervical cancer every 2 minutes. In India, this happens every 8 minutes. More women in India die from cervical cancer than in any other country. New cases of cervical cancer detected in India is approximately more than 1 lakh per year, and death is approximately more than 67,000 in a year. So we account approximately 1/4 of the incidence of the whole world, and same is the incidence of death. We account for almost 1/4 of incidence as well as death. So it has just, this is to compare that every day in India, women dying like an Airbus 320, which is a capacity of 180 approximately, dies every day. The death because of cervical cancer is more than due to pregnancy-related causes. Cervical cancer is the only cancer which is in true sense can be prevented, eliminated, and eradicated. But the dilemma is, why I'm saying this, because this cervix is easily accessible. Well-known causative factors we all know, this HPV virus, prolonged pre-invasive stage. Before getting malignancy, there's a prolonged years, 12 years, 13 years, this pre-invasive states exist. And ability to, we have all the gadgets available to to screen, diagnose, and treat at this pre-invasive stage. Because here, if we detect, we treat, the cancer is not going to happen. That's why the Director General of WHO, Dr. Tedros, he used to say, he very strongly said that it is simply no longer acceptable that any woman should die from a cause which is totally preventable and treatable. We have all the tools that we need and consign this cervical cancer into the history book. The tools are vaccination, screening, treatment, and palliative care. So this is for those who are not gynecologists participating in this session. This is the cervix, which is which is a part which connects vagina, the cylindrical part which connects vagina to the cervix, to the body of the uterus. The lower part, this is external os, and upper one, you can see this. I just wanted to show the endocervix. And the part between endocervix and ectocervix, there lies a transformation zone. Transformation zone is this is the site, this is the area, this is a place where it is not a static, it is a very dynamic area which constantly there's a changes, and this is the area where all the infection get attacks. So HPV also here infection. If there is HPV infection, it causes damage at this area and get incorporated into the cells. Cervical cancer in prevention and in the these two legends has a great role. The on left side is Dr. George Papnicolin. He used to see the cervical smears and look and detected that these are the pre-malignant changes. We call it CIN. So he, with his effort, a pap smear test developed after his name, the test called pap smear, and this pap smear is the screening modality which detects the pre-invasive phase of the cervix, at which we can, if we see the patient, the cancer cervix is automatically is not going to happen. So I can say you that in all the developed places, they have brought down their incidence of cervical cancer down because of this pap smear screening test with a very well organized system. On the right side is Dr. Harald Zerhussan. He's a German virologist. He used to look for the cause of cervical cancer, and he ultimately was successful. And he's the person who detected that the HPV is the cause of cervical cancer, and for that he got the Nobel Prize in 2008. So human papilloma virus is no doubt is the cause of cervical cancer. Human papilloma virus is the most common viral sexually transmitted disease globally, not in India only. 50% of sexually active adults gets infected. It's usually asymptomatic, subclinical, multifocal. Mind you, it is not at one place. It used to be at multi places, and the nature is of persistent. Immune response is it's very timid. The antibody titer is very low, and usually there is no viremia if there is HPV infection, and there is no drug to treat this till date. A little bit about HPV types. Based on the oncogenic potential of this virus, this is a DNA virus, it has been divided into three categories. Low risk, which I have mentioned few strains. If this if somebody gets infected with this one, the infection, if it is persistent, then it will lead to genital wart. Next is probable high risk and high risk. These the high risk is the main culprit for the cervical cancer. If this infection gets into the cervix, and if it is persistent, then it will lead to precancerous or cancerous. And 70% of the cervical cancer is because of 16 and 18 strain. And that's why the vaccine has developed against these two strains. This is a picture which I shared with you all because I was impressed with this. This is an artist impression of cervical cancer due to HPV virus. This is a table which is just showing that what is the prevalence of HPV infection among women by age, including high risk and low risk both. You can see the 20 to 24 years is the age where it has got maximum prevalence, but from right from 14 to 49, the prevalence is quite high. So this is important to understand clearance rate of high risk type, because HPV infection is so common, but everybody is not getting cervical cancer. So the clearance is important. The clearance rate is very high here. And you can see after 8 months, it's 70%. After 12 months, it is 80%. And after 18 months, it's almost 90%. So that's why if any patient used to have HPV infection high grade, we used to be conservative, particularly in young patient. But if after 2 years, if it is persistent, the test showing the presence of HPV virus or cellular changes, then we treat such patient. But 2 years you can wait. What are the cancer it causes? The HPV virus, what cancer it causes? So in cervix, almost all cervical cancer is because of HPV infection. Anal cancer is almost 80%. It is because of cervical cancer. Vulvar or vaginal is nearly 40%. Penile cancer is about 30%. Mouth and throat is about 10 to 20%. This is a age incidence. We all should know what is the peak age for cervical cancer. So you can see from 25 till 45. I should say like 50. Thus, the incidence of cervical cancer is very high. After that, it gets declining mode. And in India, if you ask me, the highest incidence of cervical cancer is in Mizoram, and the lowest in the, sorry, I'm very sorry. Who are at risk for cervical cancer? All should know. Also, another woman whose partner or
बैठ के सुन लेती हूँ. कुछ सुनाई नहीं दे रहा है, क्या हो गया है? ये नेटवर्क इशू है.
those who are using oral contraceptive pills as a contraception,
हाथ लगता है.
sexually transmitted disease, immune suppressed cases like multiple pregnancy or those in early pregnancy or parity, use of steroids.
हस्बैंड लेकर आ रहे हैं.
Have organ transplant.
Whoever is speaking, please mute yourself while the lecture is going on. I request others to please mute yourself. It is very disturbing. Carry on, Anju.
Thank you so much. Or who are HIV infected. These are the category who are immunosuppressed. So like any other infection, HPV infection is liable to happen in these cases. Smoking. Tobacco is linked, I think, with the many cancers, and so is the cervical cancer, either active or passive. Women who did not have pap smear in last 5 years, it has been said that those who are not having any screening, they are more likely to have cervical cancer because the pre-cancer stage is being undetected. This is a service with the many faces, because you can see normal. This is the normal what we want to have with all the female, then low grade, high grade, and then the cancer, frank cancer. So in low grade and high grade, these are the lesions which can be detected, treated, and patient can be cured. But if you detect the patient at this stage, sorry, we can control, but you cannot cure a patient. So usually, if you are not treating patient who used to come to us from many times from the urology department as with the reference, and because the cervix and the ureter is very close, 1 to 2 centimeter. I used to say tell our SRs also, because this is the area where during surgery also you are liable to injure this ureter. So when the cervical cancer, it spreads laterally usually, and the ureter is the first organ to get entrapped, and then obstructive uropathy, uremia, and all, it happens. So this is a very common problem in cervical cancer. Structures, vagina, urethra, rectum, so it's all kind of fistula. We have seen a lot of patients, particularly in our residency time in Queen Mary Hospital, cervical cancer. But now, probably because of more better awareness, better treatment. So talking about the burden of cervical cancer, burden is disease related, that is physical.
ये कोविड-19 ट्रेनिंग यूपी में कौन है? प्लीज अपने आप को म्यूट करिए. कोविड-19 ट्रेनिंग यूपी, प्लीज म्यूट योरसेल्फ. Thank you. Carry on, Anju.
Cervical cancer quality of life. The quality of life is much lower as compared to breast cancer. The lower quality of life is because of severe emotional distress, physical, psychological, and sexual impairment, and anxiety. The psychological and social problem is because of change in body image, loss of interest in sexual activity, reduced self-esteem, lack of confidence, dyspareunia, apareunia, failed orgasm, depression, marital disharmony. This is very important for female. So what we need to do, we need to do something to get this problem. Either we need to prevent or we need to control this. So for that, there are modalities. Primary, as you all know, primary modality to prevent any disease is vaccination. So is HPV vaccine. Secondary prevention is screening, detection, and treatment of pre-cancerous lesion. And tertiary, of course, when we treat and do palliative care in invasive cancer. So primary prevention, vaccination is probably the most realistic intervention for cervical cancer prevention. No doubt about that, because the studies are showing that where the vaccination is up to good level, the incidence of cervical cancer is going down. So this is the basis of cervical cancer. You can see the primary prevention is the main, it making the main base. So this is the main area where we need to focus. And then comes secondary prevention. It has got role, but the primary is more important. And then cancer treatment and palliative care. So why vaccination? Because it is highly effective at preventing the infection of susceptible women with the HPV types covered by the vaccine. Mind you, it is only going to prevent you from that particular strain which the vaccine is carrying. HPV vaccine can be given to all female between 9 to 14 age group, 2 doses only, but catch-up can be done up to 26 years of age, but it is not that effective, mind you. And up to 45 years of age, HPV vaccine can be given, but here 3 doses has to be given over the period of 6 months. But again, I will say that the efficacy of vaccine is not of that level, of that mark as we get in 9 to 14 years of age group of children. Now, single dose is also being the researchers are also doing single dose vaccine planning, and they have done a study with single dose HPV vaccine, and it is quite efficacious. But recommendation, we have to wait for the recommendation. Optimal timing for primary prevention. WHO says HPV infection is sexually transmitted and is usually acquired within first few years of following sexual debut. So ideally, therefore, the vaccine should be administered before sexual debut, that is before any risk of exposure to HPV. There's many times it is been asked why vaccine? We have natural infection, but mind you, natural infection has got weak antibody response and vaccination has got high antibody response. That's why it is being given. This is a very important slide, particularly those who have young girls, young daughters or relatives, because if HPV infection happens to be in young age, the chances of invasive cervical cancer is 5 times more than if you have infection more than relatively older age group. So that's why it's important to vaccinate younger, our adolescent girls. These are the types because many lot of parents or patients, they used to come and ask which vaccine. So there are bivalent vaccine, which is Cervix, quadrivalent, which is Gardasil. Monovalent vaccine is also approved by FDA, but it is not in the recommendation. So both vaccines are equally good. Only thing is quadrivalent covers 2 non-oncogenic virus as well, which causes wart. So it gives you protection from wart also. But otherwise, the protection is almost same with both the vaccine. So this is about HPV and HPV vaccine. Now, cervical screening. Cervical screening, if you do properly, you can stop cancer before it starts. I just want to share that when I work in Liverpool, every patient has a card, used to be a card with the number, MRN number, what we are having, CR number. Every card has a column of pap smear, and that has to be filled up by the doctor or the midwives or whosoever. And if it is not done, whenever patient comes, we used to take it, either antenatal, postnatal, during gynecology, any that column has to be filled. And they used to maintain a kind of report for all the health workers and the population which coming to that hospital. So screening for cervical cancer. So now, why we are screening? So the primary aim is to detect pre-cancerous lesion, because we don't screen to see the infection in the cervix. We don't screen to see the radiotherapy effect. We see only, of course, the Bethesda system. They beautifully they explain, and the report is when the report is complete, it says all the variety of cells and what is their significance. But broadly or mainly, I should say, the screening purpose of cervical cancer is to detect pre-cancerous lesion. So, and we can brought down cervical cancer dramatically if we do a proper cervical cancer screening. This is basically for our Indian, our FOXI, our national body of obstetrics and gynecological society, and we have our own guidelines for Indian population. There are guidelines for cervical cancer screening by WHO, by different countries. They have their own guidelines according to which suit their population. So in our setup, where there's a good resource, where there's everything is available, like our hospital, but where there's a limited resources, where there's everything available, then the HPV testing is the best, no doubt. Or we can do core testing, that is HPV plus cytology, or there are other methods. VIA is a visual inspection after acetic acid application. You apply acetic acid, and the service which is suspicious, which is more where the protein synthesis is more because of dysplasia, that will become white. Or colposcopy is a instrument which magnifies the cervix approximately 20 times, and you can see the abnormal vessels. There are a lot of things to see with the colposcope, and we score, and accordingly we go for biopsy. Then, if the hospital, if we are in periphery, then the VIA is a very good method to detect the cervical, the abnormal, or I should say, precancerous lesion or colposcope followed by biopsy. What is the age? So age is 25 to 65 is the age of screening. After 65, we need to stop it. Here for via 30 to 65, but postmenopausal, this test is not very significant because because of certain anatomical issue. So age of start of screening, the cytology should be around 25 years, but HPV DNA should not start before 30, 25 to 30 you can do, but not before that. Because HPV used to get cleared by yourself. So unnecessary panic used to be there. And this should start at 30 years. What is the frequency? So if you're doing only pap smear every 3 years, you should get it. But if you're doing primary HPV testing, DNA, which our molecular department, Swasti is a very, I should say, hardworking, and she's the one who started this in our hospital first time in the state. And she's doing in hybrid capture method, and she's doing regularly. And if we are doing primary HPV DNA test, then or co-testing with like primary HPV DNA you can also do, or you can combine it with pap smear. Then every 5 years you need to get your screening test done. And here, because it's a less resource setting, so like in village and also, at least it is in, like WHO says, 2 to 3 times in whole lifetime. If one get screened by via, that is good enough. Future screening. The future screening, actually primary HPV testing is going to be future screening, because this test has got, because here you are detecting virus, you're not detecting the changes in the cell. So that is one step ahead. So HPV testing is going to be future. It's we are detecting virus at very early stage, and the sensitivity and specificity of test is very good negative predictive value of this test. So to summarize, encourage regular screening as per guidelines, 3 to 5 years, whatever you have done with your patient. Check quality of lab, because pap smear totally depends upon the lab standard. So if it is like if the lab standard they are not maintaining, then there is no value of this HPV test. Because even in a USA, you all must be knowing, there's very young lady who had twice pap smear negative, and she developed cervical cancer and she died also. So lab standardization is very important. Re-screen and re-examine women who are asymptomatic irrespective of earlier results. Suppose pap smear comes out normal, but patient is complaining, or if you're seeing that cervix is unhealthy, you do repeat test. There is no harm, because always clinical sense is always above any modality of investigation. Ensure follow-up women with whose, suppose a patient is screening positive, then if we feel that she's very young, let the body clear itself. So, but you need to follow her up 6 monthly, and after two years, if the test is positive, she must need treatment. Explore methods of self-collection of sample of HPV DNA, because then the I think will incorporate maximum population, because many patients don't come out of shy and there are many issues. So if self-sampling is advocated, it's successful, then certainly we're going to screen maximum number of females. This is actually a chart which has everything. That's why I included. It says that 93% of cancer can be prevented by vaccination and screening. That's very true. And in abroad, they used to start screening 21 initially by pap, 30 they add HPV DNA test, and 65 they stop. Unless and until your previous reports are abnormal. If normal 2 reports, you stop. And why we should screen, and what are the benefits? We should screen to detect abnormal cell. Screening, if you detect abnormal cell, abnormal pathology, you treat, so you prevent cancer. Or sometimes you do screening and you get frank cancer cells. Many times you do get pap smear. That means now the patient is having invasive cancer. Here also, I should say, invasive cancer, stage 1 cervical cancer is almost curable. Then if you do surgery, patient is almost 100% cured. So even invasive cancer we detect early. So basically, the crux of all these talk is you detect problems in at least pre-invasive phase, which is approximately 12 to 14 years. It takes so much time to develop from pre-invasive to invasive cancer. So there are new WHO guided which says that you vaccinate girls 9 to 13 years, up to 9 to 13 years. They are stressing more and more towards younger age group, like 9 to 13 is quite young because of high immunogenicity, and of course the HPV infection, the high to protect from the high risk HPV strain. Use HPV test as a screen test because of its I earlier said, because of good negative predictive value, good sensitivity and specificity, and they seek it, communicate more widely. But your audience should be wide: adolescent, parents, educator, leader, people working at all sphere of healthcare to reach women through their life. That's why I included this time more and more my groups. So a world without cervical cancer by 2030. This is the vision of WHO, and we should all cooperate with them. And the vision means vaccination. 90% of the girls less than 50 years should be vaccinated. 90% should be vaccinated by 2030. 70% of the women between 35 to 45 years should have screening, cervical screening test done, and mortality should be less, 30% less, whatever existing is we have. And this is a basically call to action. In May 2018, Dr. Tedros and his advisor, they issued a call to eliminate the cervical. This is a very small 1-minute video, but you all must listen it.
In May 2018, we issued a call to action to eliminate cervical cancer. No woman should suffer from a deadly disease that's both preventable and curable.
The inequity is especially acute in vulnerable communities and in developing countries where the burden is greatest. At the direction of WHO's member states, we mobilized with countries, partners, experts, and advocates to develop a global strategy for elimination, which was adopted by the 73rd World Health Assembly.
To set countries on the path towards elimination, by the year 2030, we must aim to achieve the 90-70-90.
90% of girls to be fully vaccinated with the HPV vaccine by age 15.
70% women to be screened at least twice with a high performance test.
90% of women with pre-cancer or cancer to receive the appropriate care and treatment, including palliative care.
We believe that all countries can achieve these ambitious goals.
Please join us in the fight to end the inequity and restore women's dignity.
Together,
we
can eliminate cervical cancer.
So that's all. This was so simple, but very motivating and powerful message for all of us. That's all. Let's join hand for fight to fight cancer. Including my friends, to just, this is a kind of boost for everyone that to do all gynecologists as a gynecologist. Fight screening for we are going to do that. So thank you so much for patient hearing.
Can we have Dr. Deepa's opinion now? Madam would like to comment. Dr. Deepa? Is she here? Dr. Deepa?
I'll give her a call.
Please do.
मैं हूँ यहीं पे, अनम्यूट ही नहीं हो रहा है.
अच्छा, she's trying to unmute herself.
नहीं हो रहा है वो ही नहीं रहा।
आप बोलो, फोन पे ही बोलो, हमें सुनाई दे रहा है।
तो डॉक्टर प्याली आप बोल लो पहले, तब तक वो अनम्यूट करने की ट्राई करती है। You go first.
Okay. So Anju, thank you. That was beautiful. You covered almost all facets of cervical cancer. Now, one more thing is that not only cervical cancer, you did mention that it causes warts also. So I will just cite one incident that I have had in my OPD. There was this 8-month-old girl who had been brought by her parents for warts around the genital area. So, like a pediatrician, my thoughts immediately went to the fact that this could be child abuse as well. But where did these warts come from, and that too around the genital area? And then, after extensive history taking, what we found that they were shared. The father was bathing the child and his towel with the child, and the father himself had warts. So many a time it happens that fomites do transmit the HPV also, and it may cause warts, and that may go undetected if they think कि ये कहाँ से आया या कैसे आया, and later on this may go on to be an HPV infection of the cervix as well. So that is what we need to be looking out for, and being in conjunction with the dermatologist maybe would help regarding such small things. Another thing is that HPV vaccine, as you mentioned, yes, the earlier the better. Otherwise, we will need 3 doses. So before sexual debut, if we can give it, it is the best. And of course, in the USA, it is being advised to boys as well for for warts, genital warts, and mouth ulcers and mouth cancers. But in India, it is not yet approved for use in males. So that is all I have to say. And if Deepa ji wants to mention a few points, you're welcome.
Yeah, absolutely, very comprehensive talk. But the message is definitely, at least for all gynecologists, कि any patient, any time, any moment, you should always screen the patient for cervical cancer, which is very, very important. Any opportunity you get to see any patient, definitely pap smear is a must. And at least if pap smear is not available, at least locally examining with either acetic acid, or at least बिल्कुल absolutely eye से ही सिर्फ देख के at least you get some idea कि क्या हाल है patient का. But a pap is definitely mandatory, and it should be advised to any patient anytime you get hold of the patient, and you can see it any time. So that is very, very true, and it is a preventable disease definitely. So we should all join hands in eliminating cancer cervix.
And Dr. Piyali, just to add your comment, I should say that in Australia, they have recommended vaccination to both boys and girls, school-going girls. When I was there, that 2007 age, and by now Australia has eradicated cervical cancer. That is the one thing which I just forgot to tell. So if you do proper counseling, proper vaccination screening, we can also do proper.
We can do it. Of course, we can do it. So, anybody else who has a question?
That is a news to me. Just a very good presentation, ma'am. Despite the topic not related to general surgeon and male, but still I couldn't. I was glued to it.
You
and
are not
this
related to you, Brajesh. You are your wife, so that's why I.
Yeah.
Wives, daughters, all of them should be
That is the
receiving
domestic reason. Yeah. No, I wanted to ask about that. In Australia, regimen is they vaccinate boys also, males also.
Yes. In USA also, it is approved for vaccination in males.
Okay.
I think in India also some people are doing it. The private practitioners are, I think.
But Prerna, that is illegal.
Also.
That's illegal, Prerna, unless it is approved.
I don't think so. Let's just verify this. I don't think it's illegal because
it's
people
illegal.
are giving it in Delhi.
No, unless approved, you cannot do it.
Yeah, but it's approved for use in men also, bhai, in India. Gardasil या cervix में से एक.
ना, अभी तक इंडिया में approval नहीं मिला है.
Are you sure? Let's verify this.
Yes.
Because I think because I know people who are giving it and they are not the kind
very
of
new,
illegal
2-3
stuff.
महीने के अंदर होगा तो ठीक है. I don't know, but before that it was not in sort of approved in India.
Actually, this is Banani. I just saw the IUP immunization recommendations just yesterday. The latest Indian pediatrics has come out. I was also looking for it that whether they had specifically said that only girls should get it. But
Yes.
it is not saying so. So you can check, Dr. Piyali. I think it is possible that.
If it is the latest news, then I don't know.
Okay. So
I'm pretty
maybe
sure
the
that it
IUP
is
also
approved
has
for
changed.
use in men. One of the two, Gardasil or Cervix. I'm pretty sure one of them is approved for use in men, but we'll just confirm this sometime.
Prerna, it is approved for use in men, but whether in India or not, that is the Indian government has to give, the FDA has to give permission for use in India.
मतलब इसमें तो ये है कि मैम शादी से पहले जो लोग कुंडली मैच कराते हैं,
talking about India, let's just confirm this.
शादी से पहले जो कुंडली मैच कराते हैं, ये 2 डोज का वैक्सीनेशन शेड्यूल देखना चाहिए दोनों पक्षों को.
Good one.
वैसे तो बहुत कुछ देखना चाहिए, थैलेसीमिया स्क्रीनिंग करना चाहिए.
But vaccination really is really important. You are living one of the. It's a male को तो vaccinate करना is a good option, but let's see when we are getting approval, then only we can eradicate it, because only female we are focusing on female only right now.
True.
My strong recommendation would be. My strong recommendation would be that the central school के through इसका एक lecture करा दीजिए, because these are very vulnerable populations, and they are the ones whom we can easily approach. And I'm sure they're having an online platform because they're having their online classes. So
online classes, yeah. That's a very good idea.
I think you should have a special drive to give this lecture to the residents, because I don't know how many of them would be vaccinated, and they're a very important population, and
how many will be having a pap smear done in the last 5 years? That is also one factor.
Very true. I think most of us also would have started pap smear pretty late. I don't think any of us would have started at 25. I'm pretty sure.
No. We didn't have
Not
the
done
awareness.
ever. Not done ever. Once only,
No.
I think. So I think, the awareness is very, very low.
Now get HPV DNA test done. It is available in our hospital, so it's better to get it done once in 5 years.
When was that time that she did that big thing in screening in GH? I don't remember. Do you remember the day?
Couple of years back.
That was a.
जो स्वास्थ्य ने किया था.
हाँ.
Anju, can we have it now? We can have this vaccination. Is it? I'm Shashi here.
Okay, ma'am. Actually, vaccination has got true value, true meaning, true efficacy in 9 to 14 years of age. No doubt about that. A lot of study has been done, and but the CDC says that till 26 weeks you can vaccinate these 3 doses, but the amount of antibody, the immunogenicity is not that good, which we see in 9 to 14 years. And 45 years you can take, but the benefit is not that much. Of course, it is not going to harm. You have little effect, because whatever HPV infection you harbor, and if the vaccine has got that HPV strain, then you get protection, but it's not going to be at your age.
Okay, good. Anju, can we have your recording? Actually, I joined little late. I joined very late, actually, towards the end of your talk. So
the recordings all go on the NRC channel on YouTube. It will be up pretty soon, I think.
Okay. That's very good. Anybody.
I'll send you the link when I see it.
Yeah, sure.
I also want to say something positive. Dr. Deepa and I, because we're talking about CA cervix, Dr. Deepa and I saw two women who we thought, Dr. Deepa thought were CA cervix. They both turned out to have tuberculosis of the cervix, and we treated for tuberculosis and they did fine. So they were both youngish women in their 30s. So those were two stories which ended very happily. So yes, in India, which is where tuberculosis is very, very prevalent, we have to also be केयरफुल एंड ओनली बिकॉज ईबी भेजा था उनका, ईबी में ग्रैन्युलोमास दिखे और फिर से उनके स्मेयर कराए तो यू कुड सी एएफबी. So both of them did very, very well with just treatment for tuberculosis. And one of them, I have the pictures. The lesion looked absolutely like cervical cancer. They were friable lesions which were bleeding to touch.
And there's one more patient I would just like to quote, Prerna. Hello. One more patient I would like to quote. There was a young unmarried girl who has been bleeding, who had been bleeding for last 4 to 5 months, 6 months almost. So everyone was just giving her hemostatic or hormones diye chale ja rahe the. Then when we did her this thing examination under anesthesia, there was a big mass arising from the cervix, and she was hardly 22-year-old. That's all. Then of course we did a biopsy, तो वो frank malignancy आया. उसके बाद of course since it was a polypoidal tumor, we could remove the tumor and then we send her to AIMS for trachelectomy. So that cervix was removed and the uterus was preserved. So she's having her periods and she's on follow-up all the time. So unmarried girls में कभी-कभी ऐसा हो जाता है, then we should also think about this also. कभी ऐसा भी होता है, उनमें भी हो सकता है.
What?
We used to get patients from periphery, and patient used to bleed. A lot of hemostatic is being given, but no one used to see put the speculum and see the cervix. This is a very common scenario in periphery. The surgeons, I mean, everyone used to try, hit and try. And we also, I remember also the one patient, young patient, 35 to 40, she was bleeding and hemostatic, but once she came here, just we put the speculum, she has frank malignancy and advanced stage. So this is, I mean, this part is, I should say, everyone should stress on clinical examination. And of course, tuberculosis is something which is very common in our country. So differential diagnosis is always tuberculosis, and we have to, I mean, keep in mind that this possibility could also be there. And of course, tuberculosis, if turn out to be, it's good for patient because it's treatable. But cancer service is, of course, not treatable. It only gets controlled.
I would like to add one point, ma'am, at this point. This is the right moment for it. Since the cancer CA cervix awareness is the main crux behind this today's lecture.
Yes.
So charity begins at home, and it is high time, as Dr. Banani rightly pointed out, we should reformulate the joining form of residents, which has been formed almost 20-25 years back. Many relevant points are missing in that joining form. I think a few of the points which are relevant today can be added on that joining form, which
ब्रजेश वो मेडिकल बिल्कुल बेकार और irrelevant
बेकार,
है.
एकदम
क्या
बेकार
क्या
है.
ऐड करेंगे? हेपेटाइटिस बी की वैक्सीनेशन उसमें होनी चाहिए कि हुई
एकदम.
है कि नहीं हुई है.
या
वो फॉर्म तो एकदम बेकार है.
एकदम बेकार है.
लेकिन ऑनेस्ट नेस्ट इसमें कौन घुसेगा?
बात पूछी है. एंड इन द आर पेशेंट फाइल जो होती है उसमें आप देखोगे कि बहुत सारे कॉलम्स होते हैं, तो उसमें एक पैप्समर का भी कॉलम होना चाहिए फॉर फीमेल.
Yes, that's very relevant. Very relevant.
Then we were bound to do it, and it reflexly, I mean, it will remind. So
ठीक है मैम.
Good suggestion, Rajesh. So
I think we should wind up today, Anju, now.
Yes.
If nobody else has a question. And thank you so much, all the 13 people who attended. And Anju, thank you so much. So the next session will be on what date, Anju?
28 or something, 28 to 29. Whatever
28th or 29th. So we'll send an invite that day also, so people interested can join in. 28th or 29th, be on the lookout.
Sure.
Thank you.
Thank
you everyone for joining.
Thank you, Anju. Thank you for a very nice presentation. Very important.
Okay. So bye. and enjoy Makar Sankranti, everyone. Thank you so
Yes,
much.
happy Makar Sankranti, everybody.